Well, the fear perhaps is that the numbers may be higher because that's a number of Britons that have gone to the GP and got help, but there may be many more that have hesitated to do that. I think what NICE has said is helpful. I think if someone has depression or another mental condition, it's right to offer them a range of therapies, and whether it's a tablet like Prozac, as it's known on the high street, fluoxetine, or talking therapies. I think there's a space for all these things, and I wouldn't make a judgment about one being right or wrong. I think it depends on the patient and their lifestyle and also their support network.
Nigel?
Yeah, I agree with Peter totally. That I think provided this is actually, doctors take this as a suggestion, not an instruction, that would be right. Every patient is an individual, and on the basis of that, for some people, a talking therapy may be all that's needed, may work perfectly. For others, they need a pill. Others may be able to actually get over a problem by going out and exercising. But it does depend on the individual, and it may be a combination of the whole lot. So offering a menu of remedies is absolutely right. But the danger of this is that doctors will then say, mustn't give pills, we must try and give something else. And that would worry me if they were doing that.
Yeah, Joanna, like I said, we talk about depression often. I've been very public that I've had mental health challenges in the past, and I wouldn't wish them on anyone. But there is a small part of me that worries that sometimes we perhaps overdiagnose depression, because as a human being, we have a complex range of emotions, and that is actually quite healthy. And one of those emotions is sadness. We will feel grief. We will feel anxiety, all those kind of things. And actually, they are natural emotions. And I worry sometimes that, I don't know, say if your husband leaves you or your wife leaves you or whatever, you're not going to be happy about that. You're going to be sad about that. And that's normal. And I don't know, I guess what I'm asking is, are we in danger perhaps of making a natural emotion a medical issue and then over-medicating?
I do think there is a real danger of that, and I think particularly when it comes to children, for example, the temptation to reach for medical labels is not terribly helpful, and I think actually letting children come to terms with the normal range of emotions that they might feel is an important part of growing up. But I think the really difficult job that doctors and mental health professionals have is to actually be able to differentiate what is just a normal part of growing up or life process or kind of normal range of emotions and what is actually a mental health problem. I think as far as this guidance that's been issued today from NICE, the devil's in the detail. I mean, I don't know about anybody else here, but I really struggle to see a doctor at all at the moment, and the thought of spending an hour on the phone just to get another phone call with my GP before I can actually get to see someone is enough to put me off, quite frankly. I'd have to be pretty much on my deathbed before I even bothered trying to make an appointment right now. So it's all very well for NICE to come out and say, we should be thinking about prescribing talking therapies instead. But there seems to be a shortage of counsellors at the moment, and there's a huge mental health crisis off the back of lockdown, and that's something that rarely gets talked about. And particularly in CAMS, the Teenage and Children's Mental Health Service, there's huge waiting lists, huge backlogs of people waiting to be seen. So it's all very well and good to say talking therapies, and I agree, talking therapies probably would be useful in a lot of cases. But if you can't get to see someone, if you're just stuck onto the back of a waiting list for, potentially a couple of years, then it's neither use nor ornament.
Yeah, I wonder why can't we look at there's certain cancers that have a 2-week window. I remember I was diagnosed with skin cancer a few years ago, and my practice had a 2-week time frame from me going in to having the biopsy to diagnosis. I'm sure that a big portion of that has to be completed within 2 weeks. So why can't we just put a timetable around this and actually say, if someone goes to the doctor with a mental health depression and you're going to diagnose or, prescribe, should I say, counselling, it has to be conducted in a time frame of X. Because if you do send someone to counselling and then you tell them, but by the way, you've got to wait 6 months, and when you get there, you can only have about 5 sessions, that's not really going to help anyone, is it?